Fever is always a scary symptom to us parents. I'm a pediatric ER doctor, but I'm also a mom, so I understand this. My daughter was recently sick with fevers to 105 Fahrenheit. I had to constantly remind myself to answer this question so that way I don't overreact, but also remind myself to know when to get her seen by a regular doctor or in an urgent care. So before you head to the hospital or to an ER or urgent care, here are 5 questions I want you to ask yourself whenever your child has a fever. Number 1, how old is the child with the fever, and do they have any medical problem that requires them to be seen immediately every time they have a fever? If your child is younger than 2 months, even 3 months old, we still consider them delicate, and every time they have a fever, we recommend they get seen immediately in the emergency department. The reason is their immune system is still not developed yet, and they're still not vaccinated. And at that age as well, their body cannot localize infection, so they may manifest as one side of the body and may quickly progress and generalize to the rest of the body. So even though at that age, their fever might be due to a viral illness, we tend to do blood testing, urine testing, and in some cases a lumbar puncture, which is a spinal tap, to be able to evaluate more to know what else is causing their fevers. Along the same lines of being high risk, even if your child is older but has past medical history like sickle cell anemia, leukemia, or low blood count, we recommend also following with your regular doctor to decide if they need to come into the emergency room to be evaluated for their fevers. Number 2, how does your child look? Let's ignore the number on the thermometer for 1 second and look at the child and see what they look like. Are they actively running around the area, unbothered about the fever, or are they slightly uncomfortable laying around, or are they lethargic or unconscious? If they're actively running around, it's okay not to treat the fever, make sure they're well hydrated, and let them be. If they're uncomfortable, maybe having a headache, laying around, or maybe complain of discomfort, it's also okay to treat the fevers and give them some time to recover. But if your child is not responding to fever medicines, they look lethargic or unconscious, it is best to get them evaluated in your nearest emergency department. Number 3, what other symptoms do they have that may suggest what the cause of the illness is? Do they have a mild runny nose or a sore throat as a viral infection? Do they have vomiting and diarrhea, which are pretty controlled, may also be due to a viral infection? Is your child working harder to breathe and not able to breathe on their own, or looks very uncomfortable? Runny nose and mild sore throat may be due to a viral infection, but also sore throat, headache, belly pain, and fevers may also be a sign of a strep infection in kids. So you may warrant you taking them to an urgent care or even your regular doctor's office to get them tested for strep. Testing at the office can help them get antibiotics they need and start getting care. A few episodes of vomiting with some diarrhea and fevers may mean a stomach virus. If you're able to keep your child well hydrated beyond the fevers, it's okay to observe them at home. But if they start to complain about uncontrollable abdominal pain, or they're persistently vomiting, or you're having a hard time keeping them hydrated, then it may warrant you getting them checked out again immediately. Number 4, what day of illness did the fever manifest? A lot of viral infections may have the fevers manifest within day 1 to 2 of the illness, but as they start to progress towards day 3, 4, and 5, we may get concerned about other bacterial infection, so we always want to know what day of illness is this. For example, if your child had a mild runny nose and a cough for like 4 to 5 days, and all of a sudden they're developing very high fevers, difficult to breathe in, this is a child who may get evaluated for pneumonia or an ear infection, especially because the fever is manifesting days out from the first start of the illness. It is possibly maybe another virus altogether, but we can't necessarily exclude a pneumonia without listening to them or maybe considering a chest x-ray. And number 5, how many days of fevers have they had? Viral illnesses typically can give you fevers in 3 to 5 days and more, but if you're getting to day 5 of fevers, we always recommend getting a child assessed by their regular doctor based on how they look, or in an emergency department. Secondary bacterial infections tend to occur along the line, probably around day 5 to 6 and onwards. So if a child previously started with a fever, mild cough and runny nose, and then continues to have high fevers by day 5, we get concerned if there's another secondary infection that has occurred and want them evaluated. It may not necessarily mean that your child needs antibiotics, but it will run an evaluation, take a look in the ear, see if there's any infection, listen to their lungs, see if there's pneumonia, and even in some cases for kids, check their urine and make sure they do not have a urine infection. Another disease that we always think about when kids are having 5 days of fevers or more is something we call Kawasaki disease. This typically affects blood vessels and can affect the heart. So it gives kids fevers longer than 5 days, may cause bloodshot eyes, some rashes, some discoloration in the tongue. When we are concerned about a kid or suspecting Kawasaki disease, we need an evaluation, we need to do blood testing, and in some cases we do what we call an echo of the heart. But these we cannot exclude unless we get the child evaluated. So in summary, when your child has a fever, I want you to think about it in these different 5 questions or different steps. How old they are? Do they have any past medical history? What are the symptoms do they have? How does your child look? What day of illness did they develop the fevers? And what day of fevers do they have currently? These are things that may help you decide how best to go and how best to manage your child, when to get seen in your regular pediatrician's office or when to get seen in the emergency department. Leave me a comment in the comment section about what scares you most about your child's fever or how you manage your child's fever at home. Or you can talk about what makes you decide when to go into your regular doctor's office versus emergency room. I hope this has been helpful. Don't forget to like and subscribe, and I will see you in the next video.